Dear Pure Urology viewers, good evening one and all. Today topic is not exactly the surgical technique related topic, but much more interesting for the juniors who are getting trained in India, who have ambition to go to the USA as fellow. Even I had ambition in 2005 when I finished from PGI Chandigarh, and I have written USMLE Part 1 and 2. But afterwards, I moved to Hyderabad and settled. That is by destiny. But some people will be asking questions outright USMLE at that stage. Is it correct? If you go there, will you get any first non-clinical job? How to get it? How to enter into a clinical fellowship, which is very difficult, and directly into urology, whether to become consultant or they have to do again surgical training. These doubts lot will be there. Honestly, I also don't know the answer. Fortunately, recently I came across Dr. Rohan Sharma, who, when he was in India in Nadiad, I actually did not have much interaction, but he himself came in touch with me, and immediately I asked him this topic, and he also expressed his interest to introduce about today's speaker, Dr. Rohan Sharma. I am sharing my screen. After that, I will hand over the important program. So this is not a video, but it is how to get into robotic fellowships in the USA by Dr. Rohan Sharma, who is a Bachelor of Medicine and Bachelor of Surgery, that is MBBS 2008 to 2014, Mahatma Gandhi Medical College and Hospital, Rajasthan University of Health Sciences. MS General Surgery, BJ Medical College, Ahmedabad, Gujarat University. Urology, Dr. NB, Doctorate of National Board, March 2018 to 2021, MPH Nadiad, National Board of Education, India. And current role, Senior Clinical Fellow at Advent Health Global Robotic Institute Celebration, Florida, since August 2024. Presented to national and international faculties on webinars during COVID period. Is member for West Zone Urology Society, USI, UAA, and AUA, Society of Robotic Surgery since 2022, 22, 24, like that. Quite academic interest. Is also a reviewer already for Journal of Robotic Surgery and curious by Springer Nature. So any person who has not wasted time from 2008, continuously he moved, showing his academic excellence, and as well he planned his fellowship. Let us listen from him how he started career and entered there, and how what is his plan. Rohan, thank you very much for coming in the Pure Urology. Probably you are the youngest guy to talk on the Pure Urology. I am very happy for that. Wish you will present to the needs of the present young generation like you. Thank you.
Thank you, sir. Thank you
Over to
for
you.
giving me opportunity. I am sharing my slides. I hope you can see that.
Yes.
Hi, I am Dr. Rohan Sharma. I am Senior Clinical Fellow at Global Robotics Institute. And currently I am doing a robotic fellowship under the mentorship of Dr. Vipul Patel. He is a very famous personality. He's now close to 20,000 robotic prostatectomies. And I'm really fortunate to having this opportunity to get selected in this fellowship. So basically, I'll be talking about how to approach it in a way that wastes a less time in your career and get into US as early as possible. So first, the basic question is why robotics? So, but the question is why not? So we have moved on from open surgery era to laparoscopic surgery and robotic surgery. So in open surgery era, we saw higher complication rates and longer operative time. Both it was mentally and physically exhausting for patient and surgeons. Then taking care of the patients, we moved on to laparoscopic era. Although it was beneficial for patients, but it was really having a poor ergonomics and increased learning curve for surgeons. And over the time of period, surgeons experience a lot of fatigue and really a lot of musculoskeletal complications doing the laparoscopic surgeries. So going on to robotic surgery, It's a win-win situation for both patient and surgeons. The surgeons can perform complex surgery for longer time. I'm here since last 4 months, and Dr. Vipul Patel is performing a minimum of 8 robotic prostatectomy per day. And he starts early in the morning at 6 till 4. He is doing the robotic surgery continuously, and he is not fatigued at all. So that is the benefit of robotic surgery. And why not endourology or urethroplasty? Because we have really good centers in India to get trained in stone surgeries and urethroplasties. So definitely, I won't recommend anybody to move to US or any other country to get trained for stone disease management or urethroplasty. So looking at the distribution of Da Vinci surgical systems, in 2008, there were 5,000 robotic systems placed all over the world. And till date, there are 9,000 consoles installed all over the world. But looking at the disparity, Asia has like 60% population of the world, and it has only 600 robots. And out of that, only less than 200 to 300 robots are in India. Majority of the robots are in Japan, China, South Korea. So definitely to serve for 1.3 billion people, we really need to gear up our robotic systems. So if we see the report by surgical robotic companies, every company has predicted that for the next 10 years, their focus will be to develop the robotic systems and to send their consoles basically to the Asian region, because more like approximately 60% of the population of is in the Asia. Right now, talking about the US and Canada, these places are almost they are saturated with the robots. Every hospital and every department has their own robot. Our department has 4 robots. So there is no space for these companies to expand. So what is about robotic fellowship? Robotic fellowship is not about only developing surgical skills. Here, I have seen and experienced that apart from developing surgical skills, they also teach you to be team player with colleague urologist. Even if you learn robotic surgery alone, you are not going to perform it by yourself. You need a big team. You need to have a good managing skill to keep the team together forever for at least 10 years, so that nobody moves out of the team and you suffer the there is no sense of you doing a surgery in 1 hour and your surgical team takes 1 hour to dock a robot. So actually need a fast surgical team who puts on the does the robotic docking for you, and then you come in and show your surgical skills. And over the time, you develop the surgical team. So I believe that in next 5 to 10 years, right now we have robot in the first tier cities in India. By maybe a decade, all the second and third tier cities will be full with robots. Every center will having their own robot. So the question is, are you ready to operate on the robot while the hospital provides you, or the hospital has to hire a new robotic surgeon? So I'm not against Indian fellowships. These are my colleagues, 5 colleagues who have already been done with the robotic fellowships in India. Dr. Zishan has done his is currently doing his robotic fellowship in UK. They have already completed their fellowships and already they are settled in a stable jobs in India, while I am just like I have just started. It's just 3 months for me in US. So you can see that it's really a time-consuming process. While your counterparts have already finished their robotic fellowships, they are really doing good. They are doing independent radical prostatectomies, partial nephrectomies, while I have just started my journey. So let's get started for the main talk for which we are here. So for next few slides, we'll be discussing the following points about the USMLE exams, how many fellowship programs are available for you, and how to approach these program directors, and how to know which program will work best for you. And at the end of the slide, we have something special for young urologists so that it can be helpful to boost their career and contact the program directors and get a more insight on the robotic fellowship. So stay till the end. It will be a short discussion, but it will be fruitful for all the young robotic surgeons. So the main question is USMLE. Yeah. So do you have to give it or not? Absolutely yes. And all the steps. You have to give all the steps. Most people are confused that we are just going for fellowship and we'll come back to India. So do we need to give any USMLE steps? So the answer is yes, you have to give USMLE steps. Even if you want to talk to patient, if you want to interact with patient, you need your steps clear because that is a requirement by the US government. Many people have questioned that do we need to only give up to step 2 because we are coming back to India? No, you have to give step 3 also. And let me tell you why. So first, when you start your journey, you give step 1, which is now pass and fail exam. There is no scoring for step 1. So you give your step 1 exam. Once you pass the exam, you proceed to give step 2. And another step is OET, is a very easy occupational English test. It is like IELTS. Once you clear step 1, step 2, and OET, you qualify for ECFMG certification. ECFMG certification means now you are eligible to apply for the fellowship programs. This is just applying for the fellowship program. You have not got any US training license. So once you are eligible to apply for the training programs, and once you get selected in a fellowship, then you go to US and give your step 3 exam, which is only available in US. And once you give the step 3, it is a requirement for the states in US or the US government. They need your step 3 scores to give you a trainee license so that you can actually operate on the patients, talk to patient, make a plan for their management. Otherwise, you will end up in US joining a fellowship, and you will be only doing research work or only see the patients in the clinic. Your hospital will be hesitant to give you any operative console times. The common questions asked when you start preparing for USMLE, because by the time you clear your urology residency, you are already 30 or 31 years old. So am I too old to take this exam? I feel like it is never old to chase your ambitions. My professor, Dr. Mahesh Desai, started learning robotic surgery at the age of 66 years, and he has learned a lot. He used to travel to US to learn the robotic skills, and uh, I can see that he can finish a robotic prostatectomy within like 2 hours, 2 to 3 hours, and he can perform partial nephrectomies very easily in 2 hours. So if he can learn robotic surgery at 66 years, then what is stopping us people at the age of 31 or 32 years? What if I fail the exam? The simple answer is repeat. Repeat if you want to go for fellowship. Is it going to be worth? This is an unpredictable journey. Every person has a different journey. So if you don't like to be unpredictable, then you should not go on this path. Better you join a good robotic fellowship in India. They are offering very good fellowships. My colleague, Dr. Naveen Reddy, has done partial nephrectomies, radical prostatectomies, and a lot of surgery within 1 year of his robotic training. So if you like something predictable, Indian fellowships are best for you. What if I don't get selected by any program? Yes, there is a chance you don't get selected by the program, but you have to keep trying again every year. The fellowship position opens every year. And how much time practically would you need to prepare for it? Uh, you will minimum need 12 months to 18 months to finish with all the steps and applying for the programs. And for fellowships, definitely you don't need a good score. But if you plan to do a residency, you definitely need a score of 260 and above in step 2. So again, when to prepare? The best time to prepare is immediately after urology exams. Don't waste time because initial part of your uh, practice in India, you'll get a lot of free time. You will have less patient load and you will have a lot of free time to read. So best time is just immediately go for preparation for step 1 once you finish your urology residency. How many hours to dedicate? Minimum 4 hours daily. and stretch it to 8 hours a month before exam. Which books to study? Because you just need to clear the exam. You just need UWorld, First Aid, and AMBOSS. And how would you know that you are ready to give exams? You just have to take NBME and UWorld simulation exams. And once you clear these exams, you are fit to take the exams. So the dream is free, but the hustle is sold separately. So even if you are ready for the exams, these exams can be financially straining for you. So you need to save a lot of money before you start giving these exams. Just to summarize few of the cost of this exam: step 1, step 2, step 3. Each step has like 18,000 INR for each step. To give an OET exam, you need to pay 40,000 INR. For study material for these exams, they combiningly cost 1.5 lakh for all the steps. And I believe you will be traveling once or twice to US. So the visa fees is just once. It is 30,000 INR approximately. And to travel for step 3 exam, it is minimum 2 lakh INR. And add the cost on. If you are traveling for AUA, then you can add on 2 to 3 lakhs extra. If some program director calls you and you have to visit the center for 7 days, 15 days, keep on adding 3 lakhs every time you visit US. So, okay, now you have completed your USMLE, you are ECFMG certified. Congratulations. One headache is clear. Now what? What next? How to approach these program directors? Now, at least you have something in hand to show these program directors that, hey, I'm dedicated. I am able to get a license in US to join your hospital. So how to know and which programs to join? So in urology, you have to apply through a match process. It's a separate match process for fellowship, and there are various societies through which you have to apply. So the main societies which you have to apply are SUO, this is Society of Uro-Oncology, Endo-Urology Society, and the third one is SUFU. So most of the robotic fellowships for us are from SUO or Endo-Urology Society. So what are these societies? So they're talking about Endo-Urology Society. They are all over the world. In Asia, we have 7 Endo-Urology fellowships. In India, at MPH Nadiad and VMMC Safdarjung, they have 2 seats in India. But we'll talk about American fellowships. So we'll be basically focusing on the North American fellowships. So there are 61 seats. They are divided into a few parts. Few fellowships are purely endourology, managing the stone and prostate diseases. Another are laparoscopy and robotics, and many of them are combined. It means it also treats stone disease, also robotics. The duration can be divided in 1 or 2 years, whatever you choose. But personally, I believe 2 years is the best because 1 year is a very less time to get settled and adapted to the US culture. So suppose if we filter out everything for robotic surgery, so we end up having 66 clinical fellowship positions in US. So that's a lot. But let's wait where the problem lies, I'll tell you. So this is the endourologist fellowship program. They have 66 seats. Also for SUO, they have approximately 50 to 60 seats. But when we go to these clinical program sites, you can see at the bottom, all applicants must have completed accredited urology residency and board certified in the US. So that's the major hurdle. These programs will not consider an application because you are an IMG and you have not cleared the urology exam in US. So what next to do? So approximately there are 80% of the programs which do not accept any candidate out of US or any candidate who have graduated in urology out of US. So we have to focus on another 20% of the seats. So these are the SEO fellowship match statistics. Here you can see if you have graduated from US or Canada, then out of 34 applications, they selected 33% of candidates. The match rate is 97%. But if you look for the IMGs, international medical graduates, 31 applications were there, but out of that, only 5% were selected. So only selection rate was 16%. And these candidates were from all over the world. They are from Europe, they are from Arabian countries, they are from Brazil, they are from African countries, also India, Japan, China. You can face competition from all over the world. Talking about the endo-urology fellowship match statistics, again, you can see the US chief residents, 32 of them applied, and the selection rate was 97%. Just one of the person was remained unmatched. But if we talk about the international medical graduates, 35 of the total candidates applied, and out of that, only 12 got selected. So the match rate was at least a little bit better than the SUO fellowship. It was approximately 30%, 34%. But still, we can see in the charts below that 25% of the people who got selected were IMGs. So it's a huge amount of number. Seeing the paper published in AUA about the match rates among the urology fellowships over the time, over 3 years, you can see in 2022 in SUO, the match percentage was 23 for IMGs. In 2023, it was only 16%, and in 2024, it was 21. For endourology, it was a little bit better. The match rate was 31%. In 2023, it was 16%, and again in 2024, it was 12. So the candidates applying from all over the world, 12 got selected. But as far as I know, from India, every year, either one or two candidates get selected combiningly in SUO or endourology fellowship. So how to apply to Endourology Society or SEO Society? What are the documents you should be having in hand to apply for the Endourology Society? So first you have to register at madmatch.aua. You have to go through the matching process. This is a matching process exactly same for the residency, but it is different for fellowship, and it is available on the site madmatch.aua. You have to fill in the application for Endourology Society or SEO Society. They are available online. You can download them, see them, and fill in the details. You need 3 letters of recommendations. Now, this is really important. You have to work really hard under the place where you are doing residency. So one letter is from the boss under whom you have done your residency. Another letter of recommendation can be from the places where you have traveled and done your observership. Maybe suppose you have went to Cleveland Clinic in US for observership for 7 days. So you can request a letter of recommendation from the boss under whom you did an observership. Similarly, if you have went to UK to do observership or something, at least you should have a 3 letter of recommendation that looks nice on CV. Below less than 3, they will definitely question you to put on more letter of recommendations. Definitely, you cannot apply without USMLE scores, so you have to upload your USMLE scores and ECFMG certification. Upload your CV and a personal statement of 300 to 500 words, like why you want to join this fellowship. And you have to sort out the list and send each of the details to all the program directors. So looking at so now you are ready to join the fellowship. Now how the timeline looks like. So if you apply right now for the fellowship, you will join in July 2026. So the wait time from application to join the fellowship is more than 1 year. And that's why it explains why I have to wait for 2 years after completing my residency to join a fellowship, because I was not aware of this, that I have to apply. The wait time is more than 1 year. So, but no problem, no issues. You can utilize this 1 year in completing a step 3 once you get selected in the fellowship, and complete your visa process. The only problem with Indians is the visa process. There is a long queue. So maybe your number will come after 6 months, 7 months, 8 months. So definitely 1 year is almost enough and sufficient to join the fellowship. And by this time, keep strengthening your financial situation, because you will need at least 20 to 25 lakhs to comfortably move to US and settle down here. Otherwise, you will face a lot of financial constraint for initial 6 months. Definitely, you will be getting a salary. Salary will be approximately 65 to 75,000 US dollars per year, and it will be really good to support your condition, your everything. You will live a good life, not traveling abroad, but you will have a good house to live in, good food to eat, and you can travel nearby, but you won't be able to spend much. But so better to strengthen your financial situation before you move to US. But no worries, if you have 15 lakhs, definitely you should move, because uh, you can get out with the first salary. So what should be the preference list of candidates before you join a fellowship? You should not go for any fellowship that is thrown to you. You should also have some priorities for your fellowship. So first will be, it should be right for you. You don't want to go in a research fellowship or clinical research fellowship if you want to be completely in a clinical fellowship and you want extremely good hands-on. So choose a program which don't have research and only have clinical, which teaches you clinical skill. If you want some research part, then you don't want to choose any clinical fellowship which does not give you a research opportunity. Why I'm talking about research upon opportunities, because these opportunities are good if you want to settle further in US. Also, although we are not going to discuss this thing, this is a separate topic. But if you want to plan to settle in US, better choose a clinical and research fellowship so that you publish a good number of papers. Reputation of the program, talk to past fellows. How is the reputation of the program? See how the fellows are doing, the past fellows are doing right now. You have to choose a program according to desired geographic location, because in US, lot of areas really have a harsh climate. You don't want to be stuck cleaning your the ice that is on your street in the morning for 1 hour. Many people end up cleaning the street ice on the street for 1 hour. Better choose, I choose Florida because I don't want to deal with ice and stuff like that. If you love cold climate, shift to a little bit north in New York or like that. But definitely choosing geographic location is really important, because you can get frustrated over time. Talking about the quality of residents and fellows in the program, definitely talk to the previous fellows or the current fellows while you visit the program or do an observership. We have almost all the fellowships have 5 working days, and they in here US, they don't work on Saturday, Sunday. Once in a month or once in a 2 month, they have on-call duties on Saturday, Sunday, on where one person from the team stays in the hospital and covers the call, while rest of the people can go and enjoy their time on Saturday, Sunday. So this is a good work-life balance you can get here. When I was in India, I have to work 7 days a week, and there was literally no time to spend with the family and like that. What will be the programs looking in for you? What will the program director searching for you? So they will be looking, have you published something? So at least have 2 publications in your name, not as a first author, then you can be a second, third, fourth author, but at least have some publications in a reputed journal. You at least need 3 letter of recommendation. Also, the letter of recommendation matters from where you got it. uh, USMLE scores doesn't matter for fellowship, but if you want to apply for residency, your scores matter a lot. You need to get 260 plus in step 2. Definitely observer experience if you want to join some desired program, like in New York or Florida, then it is better to go there personally for 7 days, 15 days, have an experience, see how they work in the clinic, how they work in the OR. And it is better they know you personally, because at the end of your observership, they will have an informal interview with the team, and there you can exchange your feelings with them, that okay, I want to go ahead with the fellowship, and they will really consider you if you personally meet them and personally do the observership there. It shows your dedication to the program. Previous work experience, definitely if you want to join a robotic program, then definitely working at a robotic hospital or doing a robotic fellowship in India definitely helps. Does age of the candidate matter? Yes, they usually will prefer a younger candidate because they are easy to train. So if there are two candidates, one is younger, they will definitely prefer a younger candidate. But if uh, there is an age gap difference of 1 or 2 years, that doesn't matter. If the older guy has good publications and he is able to show that because he was doing a robotic training in India, that's why he is 1 or 2 years older. So it won't matter a lot. So once you are done with all the things, visited your fellowship, program director, met, underwent the interview, and after maybe 6 months, they declare the result. And this was how my result looked like. They sent me a mail which showed that, okay, congratulations, you were selected for the program. You can see I selected 3 programs, and they select one which you have given the priority. So now from this result was published 1 year back. So I had now 1 year time to give my step 3 exam and now to start with the visa process and application. So summarizing the timeline, first, if you plan to go to US, focus on USMLE and ECFMG certification. By that way, at least you are able to talk to the program directors that, hey, I'm ready to join your fellowship. Do you have any spots available? Next, meet the program directors at Society of Robotic Surgeons conference, AUA, EUA conference, give a talk or present a paper there, or visit their academic program centers. They offer weekly and bi-weekly observership. Once you have decided which fellowship programs you want to join, apply through fellowship match programs via AUA match process. You can select an institute which is in SUO or Endo-Urology Society. And if you are shortlisted, you will be invited for personal interview at AUA. It's a kind of informal interview. But if you are not able to visit to AUA due to some reasons, you can request an online interview. I was not able to visit 2 institutes for the interview I was shortlisted for. So I requested an online interview, and they gave me the opportunity and talked to me for 30 minutes. And once you are selected for the fellowship, go and complete the step 3 as soon as possible, because uh, don't we don't want to waste any fellowship time studying for step 3, because you really want to focus on your robotic clinical hands-on training. So this was the thing I was talking about initially. Society of Robotic Surgeons is collaboration of all the specialties: urology, gynecology, general surgery, GI surgeons, neurosurgeons, plastic surgeons. Uh, so this conference is going to happen in Strasbourg from July 16 to 20, and in France. And I'm with Dr. Vipul Patel. I'm trying to collaborate with Robotic Urology Forum, USI, all the various societies of USI, and basically youth organization of USI. Our plan, as we discussed in the primary meeting, was to give chance to few urologists who are really dedicated to robotic programs. So if they are able to, present something good, then we will shortlist these candidates. And our plan right now is to maybe sponsor them to travel to France, or maybe sponsor their stay and give them free membership or registration. And I think in my time, never get this opportunity at AUA and EAU, where they will even sponsor your stay or membership or registration fees. And if we get a good number of registration, then even we can sponsor the trips to the France, but only for the shortlisted candidate. We are just working out with the USI and all the societies in India. How can we get it done? Maybe in 2 or 3 months, we'll find out some solution to that. But by then, get geared up and be ready to get a good abstracts ready, so that there's only 6 months left to submit the extract. So just to give you a basic idea, what the sessions will look like. So I'll talk a little bit about IRCAD France. So IRCAD France is the world's best training center for robotic surgeons and laparoscopic surgeons. They have been conducting exclusive courses since last 20 years, and To attend a 4-day course, they charge you like 4,000 euros. But if you come to France for the conference, you can see here we have all the sessions in arcade. We have a special session for SRS Asia for at least 3 hours, where all the people can present their robotic experience. We have also a session for young urologists where they can showcase their skills and actually compete with the urologist at international level. Also, we have an 8-hour urology lab, and that too arcade, and that too for free, where you can just go and there are more than 30 robotic consoles from all over the world, which will be displayed for uh, for hands-on or test drive. So you can just come and check all the robots, do the test drive for like 5 to 10 minutes and see the difference. And they're really cheap. The robots these days are getting really cheap. So if you want plan to come back and want to buy a robot for your hospital, then you can suggest your hospital that, hey, I test drive this robot in France, and we really need to buy this robot. So you will be training at iCare if you want to, 8 hours of training session. And this was the list of robots which was present in SRS Orlando. I went to attend this conference in Florida this year in July, oh, sorry, June. And you can see a lot of robotic companies there, like more than 20 robotics company. And this year we expect more than 40 robotics company. They have already registered with Society of Robotic Surgeons. All of them will be there, and all of them will be there with their CEOs, managers, and you can do a test drive on that. Here we can see SSI Mantra also collaborated with the society, and last this year they showed their SSI Mantra, the latest one, the SSI 3. So I really like that. It was there, and like these, there are many companies with all the robots. Just come and do the hands-on training on them. So we would like to waive off the registration fees for young urologists if they want to come to conference. It will be a good opportunity who are interested in robotics. This is actually the registration fees, but I'm trying to work out with Dr. Patel, who is executive director of SRS meeting. So I will send special coupon codes for all the secretaries and top people in the USI society, so that they will give you like 50% to 80% discount, which will be really cheap. And if you are not able to join this meeting in person, then there is also option to join the meeting online, so that you can see what's going on. And this conference happens every year, so maybe you can part of this conference next year. So abstract submissions has already begun. Deadline is 27th May. You can submit your abstract. At least first get started with your abstract. We'll get it submitted to some nominated society in India, who will shortlist maybe 3 or 5, or that number we will come up. And these 3 or 5 abstracts will get a chance to travel to France. Maybe we will give them some kind of flight tickets, or maybe stay at hotel for free. So that we really need to work out on that, and we'll get to that within 2 or 3 months. But by that time, get your abstracts ready to submit it and get ready to prepare at the conference. I would like to extend my special thanks to all my mentors, Dr. Mahesh Desai, Dr. Sabnis, Dr. Ganpule. I'm standing on their shoulders. They actually pushed me to join the robotic fellowship, and they actually told me to go ahead with the fellowship, and they really inspired me. Dr. Mahesh Desai, learning robot at the age of 65, and he is now 78 and excellently performing the robotic surgery. So it's really inspiring for all the young generations to not train in robotics for now. I'd also like to all the surgeons on the bottom. They are all the Indian surgeons who are established in US, and they all help me out to guide me to join the fellowship. So there is always you will find some mentor who will be guiding you through the process. These were my mentors. So thank you. And for any feedback and questions, you can mail me to on my email address. And thank you, Dr. Chandramohan, sir, for giving me opportunity to talk to all the young urologists. Dr. Chandramohan is really famous among young urologists. So thank you, sir.
Thank you very much. Excellent. See, honestly, a lot of audience join, more than 150 online. Normally for surgical technique also, they don't join. It's an interesting topic. That's why I
Yes.
said to you immediately the moment we discussed. Uh, um, can we close the screen?
Yeah.
Yeah.
Uh,
So I will ask a couple of questions.
yes.
First, this SRS Society of Robotic Surgery meeting
Yeah.
for the consultants, how many days it is? How many days?
Basically, it is from 16th July to 20th.
4 days.
And yeah, 4 days. And on 15th, you have seen that we have special sessions in IRCAD. I told
Okay.
you it's the best training center. So usually what happened in Orlando is
We can
one
register with this society also, like AU, SRS Society,
no, SRS is totally different.
totally
Like
different.
totally different, yeah.
It's only conference or it's a organization
It is an organization, and SRS has been conducting the conference since last 3 to 4 years.
every year.
And yeah, and last before that it was in Melbourne.
Because it involves all the surgeries related to all the departments. If I
Yes,
come as a urologist,
yes,
how will I schedule my timing so that I don't waste much time? Because I also want to come. I travel a lot. So
yeah.
how can I best utilize the time there? Can you give some clue? Not only me, my friends who are interested in India, we can come. Well, how can we utilize time?
So we have all the special halls for each specialty.
Oh,
S-
so it will be
Yeah, so
continuous.
yeah, so you will have your urology sessions separate. You will give you a separate brochure for urology, and you just attend the urology. We'll talk about robotics, prostate, kidneys, bladder, everything will be covered in that. Also, Society of Robotic Surgery is working really hard on telesurgery,
Okay.
and India has experienced telesurgery in recently in the SIU
Yeah.
conference.
Yes.
Dr. Sudhir performed the surgery,
Here it's
telesurgery.
yeah.
Yes, Sudhir sir
So
present.
second thing, apart from the juniors who are applying for free registration, does the seniors also can send the abstracts not for free registration? Generally, they can send the abstracts. Is the
Yes, yes,
yeah,
we have a separate session for young urologists. We will
yeah.
keep all the young urologists or the training robotic surgeons in young urology session, and we can have all the senior faculties in SRS. Or
Okay.
if they want to present SRS Asia, there is a separate session.
In
So
that
we can,
case, please send me all the details. I will post in the Pure Urology.
yeah,
Every minor detail you can send by WhatsApp or you can send by Facebook, any format, so that nearly 11,000 people are there. Definitely, it
yeah,
will be helpful. Every month, we will post that.
yeah,
Basic information, it should be simple, whatever the flyers you have, that will be of great help. Now, coming to the
yeah,
second question regarding the fellowships.
yes,
If you have any relative who first degree relative who is a citizen there or green card holder there, does it
yes.
make any difference in your application if they recommend?
No, sir, that doesn't make any difference. But if do you talk about a relative as a medical person who is hiring you or somebody
Oh,
else?
somebody separate.
No, make
No.
any difference because for Indians the wait time is really very long. If you go
Yeah,
through that process, your visa gets approved in maybe 20, 30 years. So that's of no use.
that's of no use. What about the referring doctors for you? Does it make difference if the person is highly academic oriented, if your boss, and if you are referred by them, you will be given a little better chance than normal references where they don't have any papers, they don't have any research work.
So definitely, if you, I wanted to train in US like since 4 and 5 years back. So I planned my journey accordingly. So I did my urology training at MPH Nadia. I know that if I want to go ahead in US, this is the best center, or better get training at a good center where the bosses are well known or renowned all across. But talking about, first is your talent. First is how you are approaching the bosses. So I took the help of bosses only when I was sure. I talked to all the program directors in US. And once I was sure that, okay, I want to go in these three programs, then go to your bosses and tell them that I want the
Did you
letter of
write
recommendation.
papers in MPH? You had papers in MPH by the time you
Yes,
finished?
yes, I was part of three papers by then. Yes, and one video presentation. So minimum they need two publications, but they know that the research work in India and Asian countries is really less, so they don't expect you to be publishing 10 or 15 papers, but at least two papers, so that they know that you have presented at some conference and you have done at least some research work, so that they don't have to teach you baby steps to get into the research.
When you are working morning to evening, what is the professor expects you practically in the hospital? They after MCH, they expect you to record, make document, Excel program, write paper, show interest, keen on research, or they wanted to do clinical work assistance by you, or they wanted to assist you in the hospital. Like it's a practical question I'm asking. Sorry.
In
In the
US,
first few months, what do they expect?
in first few months, they will first definitely they want us to get adjusted in the environment. They want us to see the patients in the clinical scenario. Then they will, I'm right now putting ports, docking the robots. My robot docking time has improved a lot. Initially, I used to take like 7 to 10 minutes. Right now, I'm docking the robot in 3 minutes, 2 minutes. Now, last week, I've started doing the bladder drop. So they expect you to be as efficient as possible. Come early in the morning, take the rounds. Before starting the talk, I went to the wards, took the rounds, prepared the file for all the patients. By the time I was giving the talk, all the patients I shifted to the OR. Then I come here, give the talk. And by the time I'm going back, maybe all the other patients will be shifted. So I'll go and put the ports. Then at the end of the cases, they will, but at least they need you to at least know how to put the ports properly. But they don't expect you to be having, a lot of robotic experience to complete the,
Yeah.
you should know that you can complete the robotic prostatectomy at all. They will teach you that. The training is graded. First 1 2 months, they will give you bladder drop, then bladder neck dissection, then go to seminal vesicle, and then posterior dissection and all of that. It is a graded training. It will take one or 1.5 year. So they really go slow, but if somebody is trained good and somebody is not trained, it will not make any difference. They will make sure everybody stays at the same level.
The curriculum is fixed.
Yes, the curriculum is fixed. Yes. Hello.
Yeah, some students are good. Some students are good in expression.
Yeah.
Some students are attitude maybe less. Uh, do you think professors can observe all that? They will correct
Yeah.
properly and they will guide.
No, I think uh, regarding social skills,
Yeah,
because
social skills.
here you need a very soft skill. We cannot be rude to patients, like we straightway say the diagnosis, the treatment, and we don't get. But here you really need that soft skill. Nobody will teach you. You need your soft skill to be developed by
Yeah.
yourself, and nobody is going to teach you. Maybe 1 or 2 times they will tell you, do like this, do like that. But if they don't like you, they will hammer you in this. Even if you make a surgical complication, they won't mind. But if you're not good at social skills, not good at talking to patients, not good at conveying your message to patient, how to talk to them and manage the clinical scenarios, then they are going to hammer you. They don't care if you can do a robotic prostatectomy or not. But you should be a good person,
Yeah.
nice person. Yeah, you should be good to patient, you should be good to staff and everything. Luckily, I was taught by at MPUH to be nice to everybody, so that works for me
Yeah.
here. Yeah.
Good, good, good. That is also important. one has to learn the good skills to communicate with the patients. That's nice. Very good key points. A lot of you, in fact, kept love you also. In the messages, they kept you love you also. They are mesmerized. And I'm very happy that they are, because those who want it, they get it, they like it. So good talk. It will be there forever in the YouTube and you will be remembered. And this is the first time I have done such non-surgical talk, and it really matters a lot. Thank you very much for that, for that matter. But you plan well, and you plan more well in your future. And I wish you will reach all your goals in the future. Thank you very much. Great.
Thank you, sir. Thanks a lot.
See you at
Thanks.
Strasbourg. I will be coming definitely.
Yeah, sure. I'll definitely be, yes, presenting
Thank,
SSI there. Yeah.
thank you.